Morning, thanks for coming along this morning. As you can see, I'm joined by the Health Secretary and the Chief Medical Officer. I want to give a further brief update today on the pressures the NHS is facing and the steps we're taking to alleviate those pressures. It's fair to say the pressures continue to be very severe and the NHS remains under significant strain. That obviously reflects in part very high levels of COVID, flu and strep A and other respiratory illnesses. These short-term pressures, and we hope these are relatively short-term pressures, in addition to longer-term challenges that the NHS has been facing since before the pandemic, associated with otherwise positive trends of changing demographics and increasing expectations of what healthcare can deliver, continue to make this one of the most difficult winters in the history of the NHS. And while, and it's important to stress this point, the majority of patients continue to receive excellent and timely care, the current pressures are having an adverse impact on too many. That, of course, is despite the extraordinary efforts of staff across the whole health and care system. And once again, my thanks go to them for everything they are doing in extremely difficult circumstances. Although pressures do remain severe, some of our latest management information suggests a slight easing in some areas. For example, the number of calls to NHS 24 reduced in the past week, and feedback from NHS boards has been that the situation in accident and emergency is also stabilising. And obviously we'll see the weekly statistics published tomorrow morning. That said, A&E waiting times for many are still far higher than they should be. And that is caused to a very significant extent by the fact that hospitals remain very full. Despite some initial, very initial indications of a very slight easing of some winter pressure in the past week, hospital occupancy is still very high at this stage. In summary, therefore, pressure remains intense, but we do hope to see a further easing of it in the weeks ahead. And of course, we remain focused on supporting the service to address these pressures. I chaired another meeting of the Cross-Government Resilience Committee last Friday. Actions remain focused on two key areas. First, ensuring as much advice and support as possible is available to help people, where safe and appropriate, to avoid attendance at hospital. The ambulance service Hear and Treat and See and Treat initiatives, Hospital at Home and the continued build-up of NHS 24 capacity are all important in this regard. And second, ensuring timely discharge from hospital of patients generally, but in particular tackling delayed discharges. The Health Secretary's announcement last week of additional funding for health and care partnerships to secure available beds in care homes is important in that regard. Of course, the use of care beds on an interim basis is not new. There are already around 600 beds being used for this purpose, but this additional funding will help create even more capacity. Since that announcement was made, detailed guidance has been issued. Health and care partnerships have been working with individual care providers to identify available beds and match them with patients as appropriate. And the Resilience Committee will be receiving regular updates on progress. In addition to securing additional care home capacity, I can confirm that health boards are being asked to review before the end of January all discharge plans in acute and community hospitals to identify any patients who should be discharged more quickly and help resolve any issues that might be preventing their discharge from hospital. I also indicated last week that guidance was being issued giving health boards the flexibility during this period of intense pressure to take action they consider necessary and appropriate to protect critical and life-saving care. At present, 3 health boards, NHS Borders, NHS Ayrshire and Arran and NHS Greater Glasgow and Clyde, have temporarily paused non-urgent elective procedures in order to prioritise more urgent treatment for those who need it. Now, pausing non-urgent electives, while sometimes, as is obvious, necessary for a short period, nevertheless lengthens waiting times for patients. So I can confirm that the Government is currently working with the Golden Jubilee and with other health boards to make additional capacity available for elective operations over the weeks to come to minimise the knock-on pressure on waiting times. That will include weekday and weekend capacity and support specialties such as ophthalmology, orthopaedics and general surgery. Now, the final development since last week that is, I think, worth briefly mentioning relates to NHS pay negotiations. I'm very pleased to say that as a result of further discussions between the Health Secretary and health trade unions last week, the prospect of any immediate strike action in NHS Scotland has been removed. It is hard to overstate the importance of that. I don't want NHS staff to feel the need to strike at any time, but the impact on patients and indeed on staff in this period of acute pressure would have been especially difficult. I want to thank health trade unions for agreeing to move forward quickly now to discussion and I hope early agreement of next year's pay deal. Lastly, let me just round off with an appeal to the public. For those eligible, please get your flu and COVID vaccines if you haven't already. To everyone, to help reduce the risk of getting and spreading infection, please remember, as we all learned during the toughest times of the pandemic, the importance of hand washing and good ventilation. And please consider wearing a face covering on public transport or in indoor public places, including healthcare settings like GP waiting rooms or hospitals. So with these relatively brief comments, I will now move straight to questions. And of course, the Health Secretary and the Chief Medical Officer will take questions too. So I will go firstly to Colin Mackay from STV.
First Minister, I've got two quick questions for you. One is from the Scottish Conservatives who are complaining that patients are having to wait years for diagnostic tests, sometimes up to 3 or 4 years. Is the current crisis going to exacerbate that and make them wait even longer? And a second one, which is really just for you, of the two options that came from your National Executive at the weekend, which do you support?
On that first question, my views were set out in June, so I think you know the answer to that question, but it's important given the importance and the magnitude of this decision for the SNP and by extension for the country that our special conference in March gets the opportunity to look at the options put forward on Saturday, but also any other options that might be submitted by way of amendments and come to a collective decision. And I look forward to these discussions both in the run-up to and at the special conference in March. On the question about the health service, if I can now turn as quickly as I can to that, and I'll ask the Health Secretary to say something about the investment and work that has already been underway and continues to be taken forward to increase diagnostic capacity. As I said in my statement, any work to pause non-urgent elective care, of course, has an impact on waiting times, but we are working very hard to minimise that and to ensure catch-up as part of the overall recovery from COVID work that is being undertaken in the NHS. In terms of some of what is in the media today, I should say I'm not intending at all to minimise the impact on a patient who's been waiting an excessive period of time, but sometimes these cases that are cited about very excessive waits, I can't go into the detail of them, obviously because of patient confidentiality, but often with some of these cases there will be more complexity to these cases than perhaps is presented. But that said, there is no doubt waiting times across different procedures in the NHS right now are longer than we want them to be, which is why we are working in the various ways we talk about to reduce these. Specifically on diagnostics, I'll ask Humza to say a word about the work that is underway.
Yeah, thanks. First Minister, happy to do so. So clearly we're working to invest in as much capacity as we possibly can, and particularly as we begin to see some easing, slight easing of those pressures. If that continues over the weeks and the months to come, that's where significant investment will go. So as an example, we'll release an additional further 1.5 million to increase CT, MRI and ultrasound scan activity by a further almost 15,000 scans between this month and March of this year. I should say from the investment we've actually made thus far in 22-23, it's expected to deliver an additional 106,000 CT, MRI and ultrasound scans. So we'll keep investing in that capacity, create it where we possibly can. But as I say, hopefully as pressures begin to ease ever so slightly, that gives us the opportunity to invest in that additional and make use of that additional capacity.
Thanks. Claire McAllister from the BBC.
First Minister, you talked about empowering health boards to make decisions at local level, and the 3 health boards that paused elective, and the majority of health boards we spoke to are taking some type of emergency measures. So is this still the right approach, and how concerned are you by the decision to cancel some elective surgeries, and at what point should these decisions on the kind of bigger scale decisions of what to do here be coming from the Scottish Government?
Yes, I do think it's the right approach, and I think as you all know from listening to me over many months, day in and day out, standing at this podium, the government doesn't hesitate to step in and take really tough decisions around healthcare, both the delivery of healthcare through the NHS, but wider public health interventions if we think that is necessary. But right now it is important to empower local health boards, because while they are all dealing with intense pressure, that will be manifesting itself in different ways in different parts of the country at times, and obviously no 2 health boards are exactly the same in terms of the makeup of the areas they cover. If we were to step in right now and, for example, call for or give an instruction for a nationwide pausing of non-urgent electives, then arguably that would be going beyond what is required in some health boards and having a disproportionate and unnecessary impact on patients. So I think it is right and proper to allow health boards to make these decisions, and for all health boards or any health board that takes action like postponing non-urgent electives, the important point is that should be for as short a period as possible, and there should be as much attention paid to how we catch up on that activity as possible. I don't know, Gregor, if you want to add anything.
So if you look around the country just now, if you look at for instance, the flu incidents that we have around about the country just now, we've got a really different picture in each of our health boards just now. We've got some boards who are sitting with a flu incidence only at moderate levels, we've got some at high levels, we've still got a few who remain at extraordinary levels, but the national picture has moved from extraordinary to high in terms of the level of incidence that we're seeing with flu just now. Therefore, it's really important that we give the health boards the ability to be able to determine what they need to do to meet the demand according to their local area and the type of disease that they are seeing and need to respond to.
Thanks. Right, my list says Peter Smith from ITV News, but I'm not seeing Peter, so I'm assuming he isn't here. James Cook.
Thanks, First Minister. 2, again, hopefully very quick questions. 1, hospital occupancy. I think if I remember in previous weeks you'd mentioned a figure of 95%. I don't think you gave us a figure there. I wonder if you have that figure. And secondly, Sir Keir Starmer's the latest person to express concerns about the Scottish Parliament's gender legislation. Stephen Flynn this morning describing it as an outrage if that is blocked. Is it really an outrage if people use the established mechanism to try to resolve potential conflict in the law set out in the Scotland Act 1998?
Firstly, on hospital occupancy, the figure hasn't really changed since last week. Some of the feedback from NHS boards would suggest, if anything, it is very marginally higher than it was last week, but it is broadly in the same, which is why I said, if that figure had changed much, I would have given it, but it is broadly in. And hospital occupancy, because of the flow of patients, will probably take longer to start to reduce than accident and emergency waiting times, for example. So these things are all interconnected. Yes, I think it would be an outrage. You refer to established procedures, of course, in respect of Section 35 of the Scotland Act, a procedure that has not been used in almost a quarter of a century of the existence of the Scottish Parliament. In my view, there are no grounds to challenge this legislation. It is within the competence of the Scottish Parliament. It doesn't affect the operation of the Equality Act, and it was passed by an overwhelming majority of the Scottish Parliament after very lengthy and very intense scrutiny by MSPs of all parties represented in the Parliament. So if there is a decision to challenge, then in my view it will be quite simply a political decision, and I think it will be using trans people, already one of the most vulnerable, stigmatised groups in our society, as a political weapon, and I think that will be unconscionable and indefensible and really quite disgraceful. There is a bigger issue of principle here, and I'll come on to Keir Starmer's comments in this context, and that issue of principle is the right of the Scottish Parliament to legislate within its areas of competence. And if we see a challenge this week, then we will be seeing yet more evidence from this UK government of complete contempt for the Scottish Parliament and for devolution in principle. And I would say to anyone who might welcome that because they disagree with this particular piece of legislation, if the UK government is able to normalise action to block legislation democratically passed by the Scottish Parliament within our areas of competence on this issue, then that will embolden them to look to do it on other issues, and we will be on a very, very slippery slope indeed. So I think it is that serious, and I think the import and significance of this would go beyond the particular subject matter of the legislation. Finally, on this issue on Keir Starmer, I start to wonder, and I suspect I'm not the only one who starts to wonder, if there is anything Keir Starmer is willing to stand up and be counted on in the face of Tory attacks. I don't think the UK needs a pay limitation of this Tory government. It needs an alternative to this Tory government. But on this particular issue, of course, this is legislation that was scrutinised and voted for by Keir Starmer's own party in the Scottish Parliament. So he'd be showing, if he backed any move by the government to block this, he'd be showing utter contempt for his own Scottish party as well as the Scottish Parliament. So we'll see what happens this week, but there is no justification whatsoever for the action that is being talked about. Alan Smith from Bauer.
Thank you, First Minister. Looking at the pressure on pharmacies, community pharmacies at the moment, we've been speaking with the Whithorn pharmacy in Dumfries and Galloway, which is issuing a plea for more GPs to be deployed to the area because it says it's carried out a month's worth of pharmacy first appointments in the space of a week just due to the lack of GPs that there are in the area. They say the pressure's unsustainable right now. I know this is an issue which has been raised with the Health Secretary before, so can you provide us with an update as to what discussions have taken place, any actions that are going to be taken in that area, and when that community can expect to see improvements in the access to GPs?
I'll ask the Health Secretary to respond specifically on that issue, and the CMO might want to come in as well on the wider issues.
Yeah, happy to. First Minister, so I met with Community Pharmacy Scotland last week. We had a discussion about some of those shortages. I should say from the first instance, it's really a positive thing that Pharmacy First has been so popular. It has helped us to alleviate some of the pressure that we've seen at acute sites, and the message is clearly getting out to the public that Pharmacy First is a very good and essential service, but clearly only in those areas where we're not seeing shortages of pharmacists. What I've done since last week, because you're right, this question was raised with me, I think in particular by Finlay Carson in Dumfries and Galloway. I've asked the Chief Pharmaceutical Officer, Alison Strath, to engage directly with those health boards, Dumfries and Galloway being one of them, the Borders being another, where we see some shortages, to see if there's anything further we can do nationally to provide some support for pharmaceutical support. There's also a number of asks that came from my meeting with Community Pharmacy Scotland last Thursday, to which I've said to them I'll consider with a very open mind, so we'll engage with that quite intensively.
I think I'll hand over to see if CMO wants to say any more, but I think while you're asking about a particular part of the country and particular pressures, I think this illustrates the wider importance of, when we're talking about pressure in the health service, in this case primary care, thinking in terms of the multidisciplinary team and the whole system. So part of easing pressure on GPs is investing in that wider team, pharmacy, community pharmacy, an increasingly important part of how services are delivered to patients. So there are some longer term issues here for us as well, as we continue to holistically support primary care teams to help with GPs with the pressures that they face. Gregor.
Yeah, the Pharmacy First programme obviously builds on the experience that we've had with the minor ailment service over many years now, and it's certainly one which I think has been very positive in its development, what it's been able to contribute to the response that we've had over this winter. And I know that it's very popular with both the public but also with professionals who work in the system as well. I've been engaging obviously with CPO in relation to how this service further develops over time and how we may gradually expand some of the ability of Pharmacy First to be able to respond with prescribing as well from people who have become independent prescribers. A lot of interest from other parts of the UK in terms of our experience with it in Scotland just now. We're engaging with other health services as well, so that we can begin to share the learning that we've had from it with other areas just now. But I see it as a very positive development, one that begins to signal the future of how primary care services will respond to the different types of illness and the different acuities of illness that we're likely to see over time.
Gina Davison.
Thanks very much, First Minister. So Keir Starmer at the weekend was saying that the NHS needs real reform or it will die, and he was talking about bureaucracy in particular, rather than finance, rather than staffing. I just wondered what your views were on that in terms of Scotland's NHS. And also, just going back to James's question, when he was on LBC this morning, he accused your government and the UK government of using the GRR bill as a devolution, a constitutional political football, and that this is not a political matter, but in fact a legal one if there's going to be a challenge. I wondered if
I don't really have anything to add on the GRR point in addition to what I said to James earlier on, except to say, you know, it's only becoming a constitutional issue because we've got Westminster politicians refusing to accept the right of the Scottish Parliament to legislate in an area of its own competence and making unwarranted and completely unjustified threats to challenge that legislation. So if anybody's trying to use it politically, it's those Westminster politicians. The Scottish Parliament, including Keir Starmer's own party, with one or two exceptions, voted for that bill. You know, one of the amendments that puts on the face of the bill, to put it beyond doubt that it doesn't affect the Equality Act, came from a Labour or originated with a Labour MSP. So those comments to from Keir Starmer, he needs to understand that this is not simply a proposal that's been passed by the SNP. This is a piece of legislation that's been passed by the Scottish Parliament by a significant majority, MSPs across all parties, and the vast majority of MSPs in his own party. And I think he needs to reflect very seriously on that. As to his comments on the NHS, I found his comments yesterday pretty dispiriting, to be perfectly frank. Yes, and we talk a lot about this, the reforming of patient pathways and how care is delivered in the NHS. That is underway in Scotland and will continue. The See and Treat, Hear and Treat initiatives, Hospital at Home that I've spoken about, the shift to primary care, multidisciplinary teams in primary care settings, all of that is important. I think some of what he was saying yesterday was, you know, quite dangerous in respects, and some of the advice he might have been giving to people with potentially very serious conditions not to go to their GP or to look for ways to bypass their GPs. But I'll not say any more about that because he may have not intended to say exactly what he did. But I think what people in the UK, across the UK, probably want to hear from the Leader of the Opposition at UK level, somebody who is aspiring to be Prime Minister over the next couple of years, is a commitment to invest more in the health service, would be a commitment to reverse Brexit so that some of the recruitment challenges that are being exacerbated by the loss of freedom of movement can be overcome. You know, we're investing to the maximum that we can in NHS Scotland. We're asking those who earn most to pay a bit more tax using our income tax powers. So we're doing what we can to maximise the investment going to the NHS, but to go beyond that, we need to see a UK government that actually lifts the level of investment in the NHS. That's a point I was making to the Prime Minister when I saw him last Thursday evening. I don't have very much hope that a Tory government is going to do that, but surely people would expect to hear from the Labour leader aspiring to replace a Tory government actual commitments to significant additional investment in the NHS. And for there to be a complete lack of that, I think most people, not just me, will find that really dispiriting at a time when people hope to hear more and better from a Labour leader. And I say again, you know, Keir Starmer needs to stop trying to be a pale imitation of the Tory government he's seeking to replace and actually start offering some positive alternative. Neil Pooran from PA.
Thanks, First Minister. In terms of your plans to discharge hospital patients into care homes, which you spoke about last week, can you first of all confirm how many and how many cases that's taken place within the last week? And also, have there been any reports of increased infections in care homes as a result of this? This is something that care home relatives in Scotland have been concerned about, as it would mean that the care homes shut down to them visiting their relatives.
I'll ask the Health Secretary and the Chief Medical Officer to add, but obviously infection is monitored in care homes as it is in hospitals, and infection control processes and procedures remain important. Obviously the guidance to implement the commitment and the announcement that was made last week was issued, and that is work in progress. We will start to see the figures coming to the Resilience Committee this week to show progress, and of course we'll look to see how and in what form we can share that with you. The additional beds, though, that we announced the commitment to fund last week is on top of 600 beds that are being used for interim care already in care homes. So again, this is not something that is completely new. This is something that has been used to help with current pressures in recent times, and last week's announcement builds on.
Yeah, thanks so much. Very little to add to that. I just think it's just worth reiterating the point that I made last week that, of course, those numbers of delayed discharges are not a static number. People are constantly coming in and out of the system and being discharged, and vast majority, over 95%, being discharged actually on time. So we have really well established procedures when it comes to discharge into a care home, whether that's an interim place, of which the First Minister's right, there's already 600 beds being used, or of course whether that's on a permanent basis. So we have really good infection prevention control measures in place. We were up front last week in saying, and I was up front in saying throughout the week, that the high levels of flu we were seeing and COVID, for example, may well mean that some care homes will have to restrict their admissions, not stop them altogether, but restrict their admissions, and that may slow progress in terms of the numbers we're looking to discharge. But the good news on that, of course, is that flu and COVID vaccination rates in our care homes are exceptionally high amongst residents.
Gregor.
Neil, what we've been doing over the last few weeks in the lead up certainly to the festive period is keeping a very close eye on the number of outbreaks that we're seeing in care homes, and they come about for a variety of different reasons. It's not just flu and COVID, but other infectious pressures such as norovirus as well. So monitoring all those and seeing exactly where that picture is developing. And in the run up through December, we were beginning to see those outbreaks becoming more apparent, the numbers increasing through the festive period. At that point, they were beginning to kind of crest and peak. And of course, these are a reflection of the disease burden that there is in the community. There's a direct correlation between how much infection you have within communities, and therefore how likely it is that those are then likely to be passed on into care homes. We're now seeing that picture beginning to stabilise as some of the community pressures in terms of infection are beginning to stabilise as well. We continue to keep a close eye on it, obviously, but at this moment it appears to be a stabilising picture.
Mark McLaughlin from the Times.
Morning, First Minister. Has there been any impact of the teacher strikes on NHS staffing, securing part-time staff, agency staff, or even full-time staff having to take time off to care for children?
I am not aware that that is the case in any meaningful sense, but I'll ask Humza.
No, exactly that, First Minister. We get the absence figures for NHS staff every single week, and look at last week's figures. It generally followed the trend that we saw in terms of viral infections. I'll get this week's figures later on this week, but I'm not anticipating, certainly from the feedback and the engagement that I've had with health boards up and down the country, it's not a significant factor in a meaningful sense.
Joseph Anderson from the Scotsman.
Thank you, First Minister. After you announced funding to free up community beds at last week's briefing, the Royal College of Nursing and Scottish Care expressed concerns about the plan, saying they're unlikely to work without addressing vacancies and staffing levels. But how can you make a career in the NHS attractive if you won't even pay them what they feel they deserve?
Well, we in Scotland, of course, are already offering a pay rise this year that is significantly above what has been offered elsewhere in the UK. That is a pay rise on top of NHS pay that on average is already higher than in the rest of the UK, and that differential will grow. And we are now negotiating intensively, or about to be negotiating intensively, about next year's pay rise, and you'll have seen some of the latest developments at the end of last week, which means, and as I said last week, I'm not complacent about this at all, but we remain the only part of the UK that hasn't seen NHS workers going in strike, which I think is an indication of the fact, A, that we do value NHS workers and want to pay them as much as we can within the resources we've got, and that while NHS trade unions are always very robust in arguing the interests of their members, there is an ability to sit down around a table and negotiate with them, and we'll continue to take that forward. On the point about care home beds, I mean, this is about interim care to help speed up discharge from hospital and reduce delayed discharges. It's not the overall single solution to the pressures that the NHS is facing. And of course, what we're talking about here are available staffed care home beds, and that is important. Beds that are already staffed but not currently occupied. Do you want to add anything?
The only thing I'd add is that's one of the reasons why we agreed the funding to be able to cover above 25% above the National Care Home contract, because it was coming back, feedback from Scottish Care, for example, and others who sit in our ministerial advisory group, that although First Minister's absolutely right, we're looking at staffed beds, the way to help with that in the interim, with interim care beds, might be that we have to pay above and beyond the National Care Home contract rate. So that is one of the reasons why the funding that was announced last week allows us to be able to do that, but nothing to add further to that.
Okay, thanks. My list now says Simon Johnson from the Telegraph, but I'm also not seeing Simon, I don't think. Nope. In that case, I'll go to Chris Green from The Independent.
Thanks, First Minister. Just another figure question. I think last week you gave the figures on the level of delayed discharge as 1,700 patients. I just wondered if there was an update this week on that. And also, can we expect any further action to be announced in terms of a ministerial statement or anything this week?
Firstly, on delayed discharge, I mean, obviously we publish official statistics periodically on delayed discharge, so what I'm citing right now is management figures, and remember, it's a really obvious point, but I think it is one that is always worth pointing out. The delayed discharge figure is not a static figure, it reflects admissions and discharges, so the figure is probably broadly, I think at the moment, similar to what it was last week, but of course we continue to try to get it down to speed up the discharge of those who are technically defined as delayed discharges, but the initiative I spoke about in my opening remarks of asking all health boards to review all discharge plans right now to see if we can ensure that even people who are perhaps not meeting the definition of a delayed discharge but might have a barrier to their discharge, that work has been done to reduce that as well. Okay. Lukanya Mianda from the Financial Times.
Thank you, First Minister. If I may go back on the gender reform bill, I just want to check, in the event that the UK government does act to block it, what would your options be? How will you react? What will you actually do about it? And then secondly, I'm just wondering, is the fact that you're having these press conferences, is it a sign that politically, like you have some evidence that maybe the negative headlines about the NHS are hurting the SNP?
On the last point, no, and you can read polling evidence as well as I can, so I'm not in receipt of any information that you don't already have. I'm trying to be accessible to the media. If we weren't, no doubt we'd be getting questions about why not. So I think on these kind of things, it's damned if you do, damned if you don't. So as I did during the pandemic, try to be open to your questions and to your scrutiny, and I think it's an important thing to do. On the GRR point, I'm not going to repeat everything I've already said there, but we will vigorously defend the legislation. Depending on if there is a challenge, and I hope there won't be, but the indications would suggest that that may be what we are looking at. It will depend what route to that the UK government takes. If it's a Section 33 challenge, then that will go to the Supreme Court, as I understand it, and we will defend the bill in the Supreme Court. If it's a Section 35 challenge, that would require, I think, the Scottish Government to judicially review that decision. But these are technicalities. What I can say in general is that we will absolutely, robustly and rigorously and with a very, very, very high degree of confidence defend the legislation. Kate Foster from the Daily Mail.
Minister, given the pressures on A&E and hospitals just now, if there was to be a major incident in Scotland, such as a bus crash or a train crash, would A&E departments and hospitals be able to respond to that and give the appropriate care to patients? What are the contingency measures for that?
Yes, they would, and we have a high degree of confidence in our NHS to respond to major incidents, and that is demonstrated on the sad occasions when we have major incidents. All health boards will have contingency plans in place for a variety of eventualities. Rachel Watson from The Sun.
Thank you, First Minister. I just want to ask about school strikes again. We know following lockdown about the concerns around mental health, education and social skills of children, the concerns that are around there. Education has now been disrupted again by the strikes. Are you concerned about the impact this is having on children? And yesterday the EIS called for you to show the same urgency to getting a pay resolution with teachers as you have the NHS. Are you going to step in?
I always get slightly, I reflect on questions about me stepping in. I never step out of government. I'm always involved in these issues. Of course, I'm concerned about industrial action in our schools because I don't want to see that impact on young people, and I don't want to see teachers having to take industrial action. I think what we have demonstrated, particularly or most recently, it's not the only example, but most recently in the NHS, is that we are not a government that simply digs our heels in industrial disputes. We are a government that seeks to find resolutions to disputes, a government that tries to treat public sector workers as fairly as we possibly can, to maximise pay increases within the resources we've got, and to avoid industrial action. And we stand ready, willing, and there are have been talks last week, and they will continue to do that with teachers as well. But as we also see in the NHS, it does involve compromise on both sides, and therefore I hope we will see that compromise on both sides. And remember, unlike the NHS, COSLA is a partner in teacher pay negotiations, and I hope we will see that compromise that gets to a resolution. But we are not, and I think this is well evidenced, we're not a government that simply digs our heels in and refuses to talk to trade unions. And lastly, Louise Wilson from Holyrood.
Morning, First Minister. I just want to ask quickly on the legislation that the UK government are putting through about strikes and minimum service levels. You've already said that you're against that legislation. I was wondering if you would refuse to cooperate on enforcement of that, much like you did with the trade union bill in 2015-16, if that were to pass.
We will certainly not be a willing implementer of any trade union legislation of that nature. I had a discussion with the Prime Minister about this last Thursday when I saw him. Now, it depends, the ability of the Scottish Government to do different things will depend on the framing of not just the primary legislation, which is very, very vague in the details that it includes, but the secondary legislation. In my view, that bill, given employment law is reserved, unfortunately, and I regrettably accept that right now is the reality. But the implementation of legislation like this, if you look at the sectors that are supposed to be covered by it, with one or possibly two exceptions, are devolved services. So deciding whether a minimum level of service is required and what that should be would be down to devolved services. So my view is that the legislation shouldn't happen, take that as read, but if the government is intent on going forward with it, they should not apply it to Scotland, but if they do apply it to Scotland, they should give the power to Scottish ministers to decide whether or not to implement it in the sectors affected. So I made those points strongly to the Prime Minister, and we'll see what the response is in coming weeks and months. Any final comments, Gregor?
No, nothing to add.
Okay, in that case, thank you all very much for your time.